Okay, hi April. It's Dr. Buford. We're just getting started on your right shoulder. We're looking at from the back to the front. Pause for 1 second, guys. We've got two cannulas coming in the front. Your shoulder is very, very loose and would dislocate very easily to the front, which is what we expected. We're going to get to work. We've got a bunch of things to repair in the front. We've got this injury to the humeral head. We're going to have to sort out what we're going to do with that. Usually nothing, but it depends on what we have to do. It's a little bit more medial than a normal. Hard to do a procedure we call a remplissage into that because it's so centrally located. But usually if we repair the front of the shoulder, that won't be an issue. So we're going to go ahead and get to work. We're going to start in the back. We'll go off on the video. Pause, please. Okay. This is a banker that we call, it's called a Y-Knot. And it should be buried now. Go back just to seat the anchor. And that feels pretty seated, so we'll go ahead and one suture out the front. Like that. And then we're going to take a special type of needle called right side here. It's loaded with a black wire called the super shuttle. There it is. And so what we're going to do, Mitzi, grab that from him and put it in the front. I got the camera from it. We're going to start here, and we're going to take a bite of the capsule. Like that. And then we're going to bring this underneath the labrum. And we're going to feed this through. And then actually Mitzi is going to reach in and grab the relay in just a second once we get organized here and get positioned. Okay, so now as we pull back on the wire, is that the camera? It's going to bring that suture with it. There it goes. And now what we're going to do is tie a what's our flow and pressure on? So you can see how we tighten that down, how that gives us a nice firm hold on the tissue, creates a bit of a bump. I think that's all we're going to do in the back. Now we're going to get to in the front. Pause, please. I need a pellet. Okay, we're just placing these implants down in the bone. We'll show you some more in a second. We've already got one done. I'm going to show you the second one in here in a minute. Is it on? Mm-hmm. Okay, so we've got the first one we've put in and tied down there. That's the first one in the front of the shoulder. Here's the second one in the front of the shoulder. And we're going to start through here. And you can see where the tip comes up right there. We're going to have to grab right on it to pull it out. Okay, so we'll show you some more in just a minute. Placed 3 anchors and 3 sutures in the front of the shoulder. You can just see the third one at the bottom. And then we've placed that one in the back. We've made some little vascular holes in the little defect here, but you can see how it's not a normal Hill-Sachs. It's way here medial. Normal Hill-Sachs we would expect to be up here a little bit farther. So as a result, even if we wanted to, we couldn't do any kind of technique where we sew something into that defect because it's way medial. It would really tighten the shoulder. So we did the next best thing, which is make some little, essentially some little poke holes in the bone. We'll smooth some of this out with a shaver, and then we'll get you back to the recovery room. Good luck to you now. Bye-bye.